All right. Hello, everybody, and welcome to our top 5 series for Ryerson's alumni and friends. My name is Christian Mehta, and I'm the AVP of Engagement at the university. And I'm delighted to be your moderator for this important session. Before we begin, I want to pay my respects to the Indigenous peoples, elders, and ancestors who stewarded and cared for the nature and people who lived on the land where Ryerson is located today. At the university, we have made a deep and long-lasting commitment to truth and reconciliation. And I invite you to learn more about this work online and in person next time we can get together on campus, which I hope will be very, very soon. We know you've got a lot on the go, so this is a 30-minute webinar. We'll dive in quickly, but before I introduce our presenter, Farrah Khan, I have a few housekeeping tips to share. In about 20 minutes, Farrah will be taking your questions. So if you have something that you want to ask, please send the question to Jennifer Hicks using the chat function so she can moderate the flow. Your cameras and mics are off, so sending your question to Jennifer is the best way to go. Second, if you're on social media, please use hashtag #RUTop5. Now, I'm so excited and happy to introduce our today's expert. Farrah Khan is a nationally recognized advocate and educator with 2 decades of addressing sexual violence. Currently, she leads Ryerson's Consent Comes First office while continuing to be an important voice at many national and international tables. She is the founder of Possibility Seeds, a member of the Government of Canada's Federal Strategy Against Gender-Based Violence Advisory Council, board member of Girl Guides of Canada, and the member of the Community Advisory Group for Ontario Human Rights Commission. Farrah is co-founder of innovative community projects, including Use the Right Words, media reporting on sexual violence, and co-director of Courage to Act, the first national project of its kind to address and prevent gender-based violence on post-secondary campuses in Canada. She regularly contributes to national media with her expertise in addressing gender-based violence and is the recipient of numerous awards, including the Toronto Community Foundation's Vital People Award. In 2018, Farrah was appointed to the Gender Equality Advisory Council for the G7 Summit. At the summit, Farrah addressed an audience of world leaders, insisting that any discussion about a thriving, sustainable, and peaceful world is not possible without taking concrete action on net gender equity. Wow, Farrah, thank you so much for all that you do for our Ryerson community, our city, and on the national and international stages. Over to you now for the next 20 minutes.
I'm going to unmute myself. Hi, everyone. Thank you so much for joining me and nerding out about one of my favorite topics, gender equality. We're going to talk about how it is impacted by what's happening with the global pandemic of COVID-19. And so as we move forward, I just want to tell you, I do work for the Office of Consent Comes First, the Office of Sexual Violence Support and Education at Ryerson University. We support any community member at Ryerson that's affected by sexual violence. So if you are a current Ryerson student, a staff member, or faculty member, we're here to support you at this time. Also, if you're an alumni and you have concerns that have maybe happened previously, please contact our office. We want to hear from you. So I always like this quote by Adrienne May Brown, and she says, "Things are not getting worse, they're getting uncovered. We must hold each other tight as we continue to pull back the veil." And for me, that really speaks to what's happening right now. Gender equality has always been a challenge. Gender equality is something we have to continue to strive for, but it is exacerbated by a pandemic like this that is happening. And of course, I can't cover everything that is happening right now. So I know you might raise, what about this issue or that issue? I know there's so much happening, but I'm going to talk about kind of these things that we're seeing on the broad spectrum right now. So what we know is care work is something that is predominantly held by women in terms of caring for children, sick folks, elderly adults, or people with disabilities. Women are leading that. And specifically, we're talking about racialized women, people new to Canada, and people here that are working temporarily. So it's important to recognize the fact that when we talk about the care economy that is kind of holding up what is happening right now, those are majority women. We also know too that 87% of low-income, lone parent households are held and led by women in Ontario. So when we talk about income security and we talk about the pandemic and how it's affecting the economy, we have to recognize that people that are really being affected are women, specifically women of color, Indigenous women, and Black women. And so that's an important conversation we need to continue to have. We have to know too that women make up the majority of Canada's minimum wage workers, and a third of working women make less than $15 an hour. And so when we talk about the idea of decent wage and a living wage for folks, we have to go beyond $15, but people are not even making that. And so we talk about essential workers. A majority of essential workers that we're talking about, folks that work in grocery stores, folks that are cleaning up all our communities, those folks are making less than minimum wage. And it's important to recognize too that the gender wage gap is attributed to the fact that women are likely working in these low wage jobs. And it doesn't mean that we don't have the skills to do other jobs. It means that that's all available to us. And we have to recognize too, when we talk about the wage gap, that it's not all the same for women. So Indigenous women working full-time will earn 35% less than non-Indigenous men, 65 cents to the dollar. Racialized women working full-time, full year earn an average of 33% less than non-racialized men, meaning 67 cents to the dollar. And newcomer women working full-time, full year earn an average of 29% less than non-newcomer men, making 71 cents to the dollar. So the wage gap, the gender wage gap, is racialized, not only about gender. And that's important to remember when we talk about women, because we're not all the same. When we talk about job loss in COVID, what we already see in the March that's come out from Statistics Canada is over half of the jobs lost in Canada were in positions that paid less than 2/3 what the average worker pays. So that's important when we talk about what actions we need to do. We need to urge our provincial governments and federal governments to change the minimum wage to $15 or more per hour, because $15 is not enough. We also have to know that 6 in 10 of the jobs that were lost in this time around COVID have been held by women. So we know that more and more women are becoming unemployed at this moment, meaning they're not able to care for family members, they're able to take care of their necessities and needs, and we know that their children also are suffering as well. We have to talk too about what is essential, sacrificial, or disposable workers. And what I mean by sacrificial, disposable is workers that we don't treat with respect or care. We keep saying essential workers over and over again and how they're heroes, but their challenges for me is that we have to treat them with the respect that they deserve. 1 in 3 jobs held by women have been designated as essential. This is what the New York Times has found in their analysis. And that's just for the US, but I can't imagine it's much different in Canada. And we have to recognize too, in those essential jobs, non-white women are more likely to be doing those essential jobs than anyone else. Yet we pay them less. So when we talk about COVID, we talk about a pandemic response, we talk about a response afterwards, that response has to include respecting the economy. A part of the economy is respecting women and actually ensuring that they have the jobs that they need and the pay that they need to actually live their lives and actually support the communities that they deserve. We need to know too that in terms of these essential workers, the harassment and violence that they experience is high level. We know that women make up nearly 70% of the global health workers in the world, and they're regularly subjected to abuse and harassment. That doesn't stop when COVID is happening, the pandemic is happening. Harassment continues. So part of our conversation about the pandemic and a part of our conversation post-pandemic is about how do we make our workplaces safer for women? Safer for everyone, knowing that LGBTQ folks, people with disabilities, Black folks, women of color, immigrant and newcomer folks, all deserve to have safe workplaces like everyone else, yet they don't at this time. We have to also understand that when we're talking a lot about long-term care workers right now, we're talking about long-term care facilities, but the issue is that when our provinces and our federal governments don't take these workers seriously, their health, they're taking their training seriously, then we're going to have what we have right now, which is an epidemic of COVID spread in those places. And across Canada, Policy Alternatives put out a really great report, and they found that across Canada, much of the long-term care workforce, when it comes to support workers, is made up of racialized women. So when we're talking about long-term care, when we're talking about caring for our elderly, which are so important, our seniors, we have to recognize that they deserve those seniors to have staff that are paid well, that are given full-time jobs, and not just given part-time jobs where you have to piecemeal put together their workplaces. We have to recognize the fact that they are going to multiple facilities, not because they want lots of different jobs, but because their employers are not offering them the full-time job and benefits they deserve. So we have to put that into place. We also have to see that health equity is a part of this conversation. The fact that data collection is really important. And the Alliance for Healthier Communities is saying this time and time again. When we talk about COVID, we have to understand the impacts of COVID-19. And those impacts of COVID-19 are not just done, everybody experiences it the same. It's not true. But if we don't have the data to back up the conversations or what we're seeing on the ground as frontline workers, then it's difficult for us to advocate for health equity. And so that means that we need governments like the Ontario government, which is the Alliance for Healthier Communities is pushing, but I know this has happened across Canada, should take in race-based data, should take in data that takes into the social locations of people impacted by COVID, the social locations about who's actually the essential workers. All those things are really important for us to understand the breadth and depth of this issue. And we're seeing that in the United States where they're saying that a majority of African-American people are dying of COVID. We want to know what the implications are in Canada in terms of race, in terms of gender, in terms of social economic background. Part of our commitment, I think, in COVID is having the conversation about essential workers being able to access their rights in terms of labor. And 15 for Fairness is having amazing conversations about this. And if you haven't signed on to their petition, I urge you to. And if you can go here, it's 15 for Fairness, pretty easy, just go on your computer. But what they're saying is many of our workers who keep our communities clean, fed, and healthy have no paid sick days or health benefits. We need to change this. We're talking about a global pandemic, which is COVID-19, and we're talking about having a gendered response to it. We have to recognize that so many women are working these low-wage jobs, have no access to paid sick days, no access to health benefits. And that's not just healthcare workers, that's grocery store workers. That are the people that are putting food on our table, people cleaning up our community, taking care of our elderly, taking care of our community. We need to care for them too. They deserve the care, not just banging our pots and pans at 7:30 at night, but actually giving them the responsibilities of having the right to have labor protections, and also the support they need when they're sick themselves. We also, when we're having these conversations, something that is near and dear to me and something that keeps me up at night is violence in the home. We know that home is not always a safe place for people. And during global pandemics, we've seen exacerbation of violence. And we're seeing that across the board. And it's very difficult to hear these stories, but we need to know this. That 1 in 10 Canadian women are saying that they do worry, are extremely concerned about violence escalating in the home during the global pandemic. This is a very serious thing to think about. We're seeing Violence Against Women services from across Canada saying that they're seeing an uptake in calls for support, or actually quiet from people they've worked with before because they're scared to speak because the abuser's in the room next to them or right beside them, and there's no way for them to leave the home. So when we look at the global pandemic, the impact on women and children, we have to talk about violence. We also can talk about LGBTQ folks as well, recognizing the fact that LGBTQ folks are in homes maybe with parents or loved ones that may not respect their gender identity or sexuality, and violence can escalate as a result. But this was already happening in Canada. We know that every 6 days, a woman is killed by their partner or ex-partner. We know with what's happening and just happened in Nova Scotia, and my whole love and heart goes out to the community in Nova Scotia about what's happened. We know that there is conversation about why someone would kill a community member. But oftentimes when we see with mass murders, there is some connection to misogyny and patriarchal hate. And so we'll wait for those stories to emerge from that, but we know that that is something we need to think about. We know too that under COVID-19, we see violence escalate in different ways. So abusers may use their increased access to women in close quarters to actually escalate the violence. They may use controlling behaviors, and they may use it as a way of denying PPE or denying their access to financial support. They may cut off their connections to their community. They may say, you know what, you can't speak to your family members on video chat. I don't want them to see your face because then they'll see the bruises. So what we know is that under a pandemic, violence does escalate. That has been the research time and time again across the globe. So when we talk about supporting women at this time, we talk about the gendered impacts. We have to talk about the support of violence against women services. We have to talk about how neighbors, friends, and family need to check in with their community members. We need to say, hey, I'm worried about you. How are you doing? Find ways to communicate, keep in touch, and keep connected, because we are all part of the solution when it comes to this. Another part of this too is recognizing that incarcerated women are in places where they are not safe, and it's impossible to keep physical distancing in prison. There is a call by the Canadian Association of Elizabeth Fry Societies to community release low-risk and vulnerable prisoners. This is a part of the conversation. We cannot forget women incarcerated. We can't forget anybody incarcerated right now. And there needs to be a conversation really clear about how we as a Canadian society will support and address this issue, because no one is disposable and everyone deserves to be safe. A part of this conversation too is around the housing crisis in Canada. This housing crisis was before COVID-19, but now continues as we see people in situations where they have not a safe house to go to, or they may not have housing security at this time. And there's insufficient and safe and affordable housing available to women. We know that women are homeless too often with their children. We know that 44% of women's shelters are full every night in Canada. So when we talk about addressing this post-pandemic and during this time, we have to talk about housing. We have to open up the hotels. We have to open up more spaces so that people have safe places to go, to take a shower, to go to the washroom, to safely sleep at night. We know too, this conversation cannot continue if we don't talk about childcare. And you may say, well, people are home, they're watching their kids. But the thing is that childcare centers themselves are at risk of shutting down completely if we don't have real infrastructure put in to support childcare centers right now. And that means ensuring that childcare centers have the financial funds to continue, that we have private and public, but specifically public dollars put into childcare centers to ensure that they can continue. We know that right now there's a dearth of people not being able to access childcare centers even before the pandemic. And now it's really great that we're seeing actually that provinces are recognizing that essential workers need access to childcare centers. It was amazing seeing in Ontario that violence against women's services, that people that are doing essential work are now able to access childcare centers. But we need more of that as this goes on. But we also need to invest in childcare centers once the pandemic is over to ensure that women can go back to work. Because you know and I know that if we don't have real childcare in Canada, then women will have to stay at home to take care of their child because they can't afford to actually work at this time. Reproductive health is another piece that is really near and dear to me, and all these issues are, but reproductive health is a huge issue. We know that women in fly-in remote and northern communities are already having to fly in to give birth or to have an abortion in Canada, and this was before the pandemic. But now there's all these restrictions around this, and it's really hard for many women to know they'll have access to reproductive health, they have access to medication that they need, and they have access to safe and emergency contraception. And also there's a growing conversation happening around hospitals, because individual hospitals have protocols and put in place regarding birth, meaning that sometimes in some hospitals, women are unable to have a partner or a friend or a doula to come with them to accompany them to a birth. That means that they don't have a second advocate or an advocate. Because let me tell you, as someone who just gave birth almost a year ago, you need an advocate in there because you are going through so much. So now there's a challenge where women are asking, and people that give birth, because not just women give birth, but people are asking what can be done, what protocols can be put in place to follow the World Health Organization's recommendations to ensure that women can give birth in a safe and healthy way. Okay, I'm good for time. One of the things I want to name, the last thing I want to name is that it's really important to take care of ourselves. I know a lot of the people that are on this right now are women, gender non-binary, and trans folks. And I want to make sure that we specifically are taking care of ourselves. The emotional labor alone that women do, that trans folks do, that gender non-binary people do to take care of our communities is enormous. We need to continue to take care of ourselves so we're able to do this. And I turn to Audre Lorde, Burst of Light essays every time I'm in these moments. And she says, caring for myself is not self-indulgence, it's self-preservation. And that is an act of political warfare. If we're going to end gender violence, if we're going to create gender justice in this country, we need to take care of ourselves. And that's on the systems that create so much hardships in our lives, but it's also on our communities to ensure that we have that space to do this. So I think we have 4 minutes for questions, and I think we can probably go a little bit longer, but let's go for some questions. I hope that was down and dirty, some of the issues that we see with gender equality in Canada post-COVID.
Absolutely. Thank you so much, Farrah. So much to absorb and so much to think about and moreover do through this presentation. And the chat, there's quite a bit on the chat, so I'm just going to dive in. This one is from Camille. How can we best advocate for women, and what are the best, how can we best raise awareness about some of the issues that you've talked about?
You know, I think it's really checking in with the organizations that are already doing the work. There's some amazing organizations that I mentioned. You know, it's a quick sending an email to a government official, check in with your MPP, keep pushing that they need to have a gendered response to COVID-19. That this can't just be something they say it's neutral and natural. No, it's not. And it's not going to impact people same. So it's pushing your MPP, it's pushing your municipal government, it's pushing your federal government, each one of those bodies of government to say, I need to know that you're going to respond to this. And talk about these issues. Really, and do the research yourself, make sure that you know more of this. I just gave you kind of the overarching view of some of the issues, but there's so much more to go here.
Great, thank you. From Pamela, what information is missing, or what do we need to know more on when we're applying a gendered lens to the pandemic?
I think we need to know more data. And I think the data has to be beyond just even gender. It has to include race. It has to include sexuality and income level. I think, you know, we're missing in the conversation really the intersectional understanding. As Kimberly Crenshaw is an amazing scholar. If you haven't read her work, I would highly recommend it. But she really speaks to this idea of intersectionality. And she actually coined the phrase and is the creator of it. We have to understand that women are more than just our gender. And so what we're missing in this conversation is who's being left behind is not just all women, it's specifically racialized women, Black women, Indigenous women. It's women living in rural and remote communities. What happened in Nova Scotia was devastating. And one of the things I thought about was, here's a rural community that has so limited resources.
Thank you. That's very powerful. And this one is from Andrea. Farrah mentioned the many challenges associated with gender. What about the new strengths and resiliences that might be emerging? Any light on that, Farrah?
Well, I think all the things we raised are actually possibility models. And I think we have to look at this time as a possibility model time, a time where we can say the things that we were told before couldn't happen, can happen. So things like universal basic income, I think it can happen. I think universal childcare should happen. I think childcare for essential workers that's paid by the government should be happening and is happening. We should look at this as a possibility time that recognizes that what is essential workers, people that oftentimes we treat as disposable or sacrificial, actually are very important and deserve to be paid properly. So I think this is actually a nerdy feminist can be exciting time in some ways. We can look at the possibilities for change that we can all harness. And Angela Davis has been talking about this with Noe Klein in another webinar that just happened. And it blew me away to kind of think about this moment. This is a moment where we have to harness the possibilities. And instead of the no's we constantly get, start getting those yeses.
Yeah, absolutely. Here's a question from Marco. For those of us that are in the security service provider world, what questions or kinds of questions can we ask that can help us shed light on the kind of support women might need, but not ask directly?
So when you're speaking to women that are experiencing violence, and I assume that that's the question, and a lot of
so too.
Yeah, I think that's a really important question. I think sometimes what's a safe place to talk? So sometimes it's, if the partner is monitoring their email, if they're monitoring all their social media, it's sometimes creating a new email that can be hidden on a phone. It's talking on apps that they already use. So, Marco, it might be making a Facebook that is not connected to your job, but is, something you can use to correspond with these women or with the community. So that's one way that people have been doing it. It's checking out encrypted services. So end-to-end encryption is really important. I think too, it's checking in on, food security is a big thing right now, which is something I should have talked about, and I apologize. So many people are worried, and rightly so, that they will not have food on the table right now. And that is a glaring thing that I missed. And, so it's the basic necessities. Can I connect you to food? Can I ensure that, are you getting your medical needs met? Are you getting the connection that you have? Because isolation is a big part of this, but so is food security. And I missed that one. I apologize.
Well, you did cover a lot. And in fact, this question speaks to one specifically around incarcerated folks, and any supports that you could see specifically for folks incarcerated who, to help them, to support them during this time.
I would really check in with organizations like the Elizabeth Fry Society and organizations that are doing work on the ground with folks incarcerated. So is it letter writing? Is it keeping communication? Is it ensuring that they have money to speak to their family members? But it's also fighting for people to be community released, because not everybody, well, we can have long conversations about the abolishment of the prison industrial complex, but I think that's another webinar.
Yeah, absolutely. It is a huge topic, and something that a lot of folks are taking up in our city in particular. Here's an interesting question. What are your thoughts on the meme going around that contends that the countries that are best dealing with the pandemic are actually countries led by women?
I love memes. I love memes. I think it's really interesting, right? Like, I think we're all blown away by women's leadership, but women are not oftentimes allowed to lead. So in Canada, we never see women get a second chance. So we oftentimes see, if your woman's a premier of a province, such as Kathleen Wynne, our former premier of Ontario, they're not given a second run. So I think that the meme is really interesting, but I think we have to support women leaders when they're in that position. And I think we have to ensure that we keep opening those doors for more women to come through. I think women's leadership is not inherently different. Like, look at Margaret Thatcher. Like, it wasn't that she was the most open-hearted person in her position, and that's saying that very lightly. So I think that's one piece, but I think we want to see more women leaders. We want to push that forward, and we want to see a different way of leading. And I think that's what I'm interested in. So it's not as much about having just women in this, but it's also the way in which they're leading. And so that's really important that we're hearing this.
Yeah. I think we have time for a couple of more quick questions. Although all of these could go on for, there's a lot of directions these questions can go in. This one is from Ibrahim. What are some possible long-term solutions for women who are engaging in precarious employment before COVID and are now left with basically no support?
I think one of the organizations is doing one of the most amazing work on this is Workers Action Center, and they're really pushing that people are paid, the wages that they should be paid. And precarious work is something that more and more people are being pushed into. So we're seeing short-term contracts or no contracts at all. We're seeing, complete human rights abuses. And so we have to really push that our labor laws are strengthened. We need to change the way in which our federal and provincial labor laws are put down. We need to ensure that people are paid a living wage, that the standard of what people are paid is way upped. And 15 is not enough. It's not a living wage. And that's something we need to also recognize. Like, it's just bare minimum. And so I think there's lots that can be done. I would really look at the Workers Action Center at 15 for Fairness. The work that they're doing is exceptional and can be used across Canada.
That's, a very important resource for us. Here, this one is from Jen. Many of our essential workers in healthcare or long-term care or even within homes are Filipina Canadian. And is there any specific data or any thoughts on how communities like this one may obtain support or perhaps access avenues for support?
That's a really important, thank you for raising that. I think we need to talk about how we use migrant labor. We need to talk about how we pay migrant labor and the promises that we don't fulfill for migrant labor. So there's that faraway promise of immigration, of getting your immigration documentation, or being able to send money back to your family in a way that actually that's money that is well paid. And we're not doing that. And so we need to relook at how we're exploiting migrant labor, and how we need to do this work. And there's an amazing organizing happening around migrant activism right now. No One is Legal, lots of groups doing this amazing work, and I highly recommend looking at that work. This is not my complete area of expertise, but I really do think that that's a piece that I keep thinking about.
Yeah. One more question. I think we have time. This one is from Helen. In your opinion, Farrah, what should governments be doing to support informal workers and in particular sex workers? How should we be supporting and protecting sex workers at this time?
Well, we need to decriminalize sex work. That's number one in Canada. I think the way in which, it was so upsetting when sex workers won the Supreme Court to actually decriminalize sex work. And then there's this awkward, horrible government not the one in power right now, but a previous government put in regulations that actually made it very difficult for sex workers to work outside the shadows. And we need to decriminalize sex work in Canada. We need to listen to sex workers. We need to trust sex workers know what's best for them. I think looking at groups like Maggie's in Toronto and Swan, lots of sex work organizations from across Canada are asking for decriminalization. Right now, there's some amazing fundraisers for sex workers going on right now, and I highly recommend supporting those. But decriminalize right to your government.
Yeah, absolutely. Well, listen, Farrah, we've run out of time, and I want to thank you so much for sharing your expertise and leadership with all of us today. It means so much, and we're looking forward to continuing the fight and seeing how the next few weeks, months, years support gender equality in our cities and country. Thank you for sharing that. That's great. How to keep in touch with Farrah and the Consent Comes First office. Just wanted to let everyone know that we have additional webinars on the go. And so once you'll receive an email with a link to register for those, as well as a link to a recording of this webinar, which I hope you'll visit again and share with as many people as you can. It's such an important conversation to have, and particularly at this moment in time, we cannot ignore it. And so Farrah, I want to thank you again for being here to share with our alumni and our community. You are awesome.
Thank you so much, everyone. It was so great being on part of this conversation with you.